So I'm Sebastien Bonnet. I'm professor in medicine in Laval University in Quebec City. I'm the acting director of the Pulmonary Hypertension Research Group at the Lung and Heart Institute of Quebec City. I started working on pulmonary hypertension about 20 years ago when I initiated my PhD thesis. I was working on hypoxia and potassium channels at the very basic level in the cells. And as everybody knows, hypoxia and potassium channel are heavily implicated in the development of pulmonary hypertension. So it was a logic transition from my very basic research to move to the pulmonary hypertension research field about 20 years ago. So about 20 some years ago in Paris, we made interesting discoveries regarding pulmonary hypertension, and been invited by, at the time, Professor Étienne-Émile Baulieu, who was the director of the Science Academia of France. And at that time we discovered that one of the molecules that Dr. Émile Baulieu discovered, which was DHEA, was able to improve pulmonary hypertension in animal models. This meeting with that person totally changed my way of doing research and totally pushed me to do translational research and try to discover new therapeutics for patients with pulmonary hypertension. And 20 years from that discovery with him, there is now a clinical trial ongoing with DHEA in the United States. So I think that person totally changed the way I was doing research and totally pushed me into the field of pulmonary hypertension and try to improve the health of patients with pulmonary hypertension. I think, having the World Symposium Association on Pulmonary Hypertension is critical, because this association giving the opportunity to have under the same roof a variety of researchers, from basic researcher, translational researcher, clinical researcher, and epidemiologists. And having all these persons working all together from different countries in the world will certainly bring new hope for patients with pulmonary hypertension. So I'm very proud to be part of that association, and I think the future looks very bright thanks to the development of this association. I think the future for pulmonary hypertension looks very interesting. I think we are entering a new area of research, which is precision medicine, and I think pulmonary hypertension will benefit from this type of study, and trying to identify which patient will be good responder to the different therapies that already exist will be something very important to develop. And I think there is a lot of hopes with all the field of epigenetics and gene therapies and all these microRNAs, long non-coding RNAs that are arising and have been shown to play a critical role in pulmonary hypertension. I think there is a lot of opportunities for developing new therapeutics, and down the road hopefully bring new hopes for the patients.